Hi, I'm Dr. David at Magnolia Skin Center. So the topic right now is PRP Microneedling facial. Um, we have compiled some questions. My team has compiled some questions for me to answer. So let's get right to it. Question number one: how does adding my own blood's growth factors to a microneedling facial erase dark circles and sunspots? First of all, let me take one step back and say, what are we talking about? A PRP microneedling facial, we're talking about using a microneedling device or pin. This is not a roller. This is a higher level than what can be done in a non-medical setting. So it's a pin that we can go all over the face and the neck, and it's moving very, very fast, making many punctures or channels in the skin to open up the skin and create these channels. It's done with topical numbing so that it's painless. And then we before we actually do the microneedling, we have drawn your blood, we process it, we um, we spin it, and then we take the top part, which has the regenerative components. And after we've made the microneedling channels, then we put that PRP, platelet-rich plasma, on that skin, and that goes through those channels into your skin. What does that do? That turns on your fibroblasts, which are the cells that make your collagen, elastin, and fibrin, regenerate and regrow your skin. So let's read that first question again. How does adding my own blood's growth factors to a microneedling facial erase dark circles and sunspots? Because this is a regenerative response, this is going to heal your skin in all kinds of ways. So it's going to even out pigment. It's going to uh, basically sort of make the pigment layer equal throughout. So areas that are lacking pigment will be able to regenerate some pigment, and areas that are dark will be able to lighten up. So it is sort of reverse aging your pigment irregularity. Question number two: will my face look intensely red or bloody right after a PRP facial, and how long does that last? So we are actually spinning the blood. So what the product that we put on your face is the yellow golden liquid of your blood on the top. It's not the red cell bloody part below. So the face will not look bloody. Now, the microneedling portion can sometimes draw a little blood, so there could be some tiny little spots of blood that you might see. Um, if if your skin does happen to be in have a lot of reaction to the needling and looks sort of red, the PRP is regenerative and will calm that down. Plus, we do also have plant-based exosomes and stem cells we can apply to absolutely get rid of any inflammation response and get it into a regenerative response and calm down that redness. So it will not look intensely red or irritated from the procedure. Can this combination facial fix stubborn stretch marks or patchiness on other parts of my body? Yes, this can be done any part of your body. And remember, like I was saying, because this is regenerative, it's turning on those fibroblasts to regrow or redevelop your skin. It's going to fix any kind of problems, whether it's stretch marks, which are really an issue with lack of connective tissue that is weakened, or other types of uh, irregular patchiness on your skin will be fixed by this rejuvenative procedure. Question number four: can I wash my face normally the night of my facial, or do I have to leave the plasma on overnight? We recommend that you not wash your face the night of the facial. Not so much, somewhat because we want the regenerative elements to make sure they go in, but mostly because we have made a lot of punctures, and we just want the face not to be touched or bothered that night. So we'll have you wash your face gently the next morning, and we'll teach you exactly, go over the products to use, the gentle cleansers that we would recommend, and what products to use, and the technique of how to wash your face with a patting mechanism instead of a rubbing mechanism. But we will go over all of that with you at Magnolia Skin Center. Question number five: how many days will it take for my skin to look incredibly hydrated, even toned, and radiant? So your face is going to look very even toned and hydrated right after the procedure because so much liquid is going in from the procedure, but it will also improve every day after. So you will immediately have improvement and then will continue to improve every day after to get that dewy, useful, glowy, radiant, hydrated look that you're looking for. Uh, Question number 6: what is the step-by-step process of drawing my blood and prepping it before putting it on my face? Basically, we draw your blood, and we have different size of these separating tubes, depending on how much we're doing. When we spin it, then we spin it and separate the liquid off the top, and that's what we use. Question number 7, if I can get through it, is how many sessions do I need to get that ultimate long-lasting smooth skin texture and radiant glow? Kind of depends on how you come in. If you're older and there's more damage, it's going to take more sessions. If you're younger, it will take less. So that just depends. It kind of, I would say something like what age you're at will determine. If you're in your 30s, maybe 2 sessions. If you're in your 40s, maybe 3 sessions. If you're in your 50s, maybe 4 sessions. So, but depending on the state that you arrive at. So we are going to customize to your situation at Magnolia Skin Center. Thank you so much.